A very good morning to you all. I am Dr. Abhishek from Park West Clinic in Coimbatore. In today's podcast, I thought we will discuss a very interesting topic which most of us already have seen in our lives, and it's nothing but orthodontics or braces. So, why are braces needed? Now, many of us are not blessed with ideally placed teeth or aligned teeth. We always, we'll tend to have teeth which are totally misshapen, which are misplaced. Some are placed up, down, front, back, rotated teeth. Okay, so if you are having a condition like this, which is, the teeth are all not even in the same line. So if you're blessed with a condition like this, we have something called braces, which you fix on top of these to adjust the teeth to the proper or the required position. So braces have been modality of treatment for a long time, from the 1950s, 60s onwards till today. The methodology is the same. The way it is achieved, a lot of new technologies, a lot of new systems have come into the market or into the clinics. So this, what you see here, is the conventional metal braces. You can see these metal brackets placed on each tooth. They'll have small rubber band like elastics around them, and these are used to pull the teeth into the right position. So this is the most simplest brace or orthodontic appliance. Then for people who start becoming more conscious and more cosmetically conscious, they don't want to be seen having these metal bits all over their teeth. So then something called ceramic braces have come. So ceramic braces are the same concept, but they are white in color. If you notice, you cannot make out much of the braces on top of the teeth, but they are there everywhere. So here you can see the metal bits nicely, but here you can't see the ceramic braces. So these were an improvement for a long time. Then, so how do braces work? Braces work by bringing the teeth with small forces. You slightly keep moving the teeth to the required position. Some teeth which are up, you bring it down. Some teeth which are low, you bring it higher. Some teeth which are rotated like this, you make it straight again. And you can do all sorts of things with orthodontics or braces. So the next step in evolution of orthodontics was something called self-ligating braces. Now these are the conventional braces, conventional metal braces and conventional ceramic braces. In self-ligating, what was achieved was the whole system was more sleeker, and there was very minimal use of these small elastics or small rubber bands. So definitely the compliance or the cooperation of the patient is also better. Nobody likes to see small elastic bands around the mouth. So since this was more sleeker and had less components, it was more user friendly. Secondly, the treatment time was also slightly faster. For example, if regular orthodontics takes a year, this could finish in about 10 months or so. So there's definitely a little improvement in speed. Third thing is, unlike the conventional treatment, which depended so much on the elasticity of the rubber bands. When the elasticity of the rubber band used to reduce, the treatment naturally slows down. That's why we keep asking the patient to come once in 25 to 30 days, because we have to keep replacing the forces. We have to keep re-engaging the forces. But in self-ligating, since it's a constant applied force, the treatment never stalls. It keeps going on the same uniform rate. Hence the treatment is also slightly faster. So that also is the same self-ligating system is there for both metal and for ceramic. So then people came with the next, as usual, the present generation is highly cosmetic driven. So what is the next option? How do you have braces doing their work without it being visible outside? So then the next step was something called lingual braces, where the same braces, the same system, the same metal braces were placed on the inner surface of the teeth, that is on the insides, upper and down. So yes, this was a good system. It was very common for a long time, but it is a very cumbersome process because it is difficult for both the the doctor and the patient to go along with this treatment for a long time. In terms of eating, in terms of maintenance, it's a very cumbersome thing. So unless it's really needed, no orthodontist will suggest it nowadays. So the latest thing that has come is something called Invisalign or clear aligners. So like I said, you have teeth which are in a bad shape or bad symmetry like this. You get these transparent silicone wraparounds which you can just clip onto the teeth. That's it. So they have become part of your teeth now. And as if you notice, they are totally invisible. Now suppose this is inside a mouth, you will not see this whole braces in your mouth. So that's why it is called Invisalign or clear aligners. They will align the teeth, yet they are totally clear. They are totally transparent. So this system is very good, especially for people who are working, people who are in the media, people who need to be seen in public a lot. There are, as I always say, there are pros and cons to everything. So for very severe cases, for very dramatic corrections, this is not a advised treatment. So, but this will help in about, say, 60 to 70% of the conditions that are seen in people's mouth. Yeah. So what is important in aligners is that these transparent silicone wraparounds have to be changed or replaced every 10 to 14 days. So we'll keep giving you these sets based on your condition. It might number from 6 up to 20 or 30. So every 2 weeks these have to be replaced and worn properly. And another important thing is, another advantage of this is that unlike the regular braces which are there all over your teeth and which will not let you eat comfortably, you have to have a lot of restrictions in your food. It's very difficult to have chewy foods like meat or chapati and all, because these things get stuck there. So after eating, you are spending a lot of time to clean. The good thing about these aligners is that whenever you want to eat, all you do is just remove them, eat whatever you like and put them back. So people who are on the move, who like to eat freely, who don't want to restrict their food, could go in for aligners. Again, I am telling, aligners are not suggested for children, not for any reason, but the level of commitment in a child is much less than that of a adult who is aware and who is paying for this, because this is not a very cheap treatment. It is fairly expensive, and so only if you are ready for it, you need to get into it. So and another advantage in aligners is that the whole treatment process is again slightly faster than self-ligating. So what was 1 year in regular ortho comes down to 10 months in self-ligating, comes down to 8 months in aligners. So all these treatments are available at our practice. It is important for the patient to meet the specialist or the dentist in your locality and discuss with them what kind of treatment is most suited for them, because it is difficult to have a one treatment for all strategy. It is a highly customized treatment. There are a lot of things that you add on. There are appliances that you add on for breaking habits, for improving your bite, for changing the way that you clench your teeth. So we might be adding on these appliances along with your regular treatment, and then finally finishing off with the regular braces. So it is a very, very customized, very individual treatment option, which you should understand. You should be very clear about before you start. Maintenance is very important in orthodontics. There are a lot of patients who get these braces done, and once it is removed, there is decay all over the teeth because they have not been brushing or not been taking care of it properly. And second thing is, never miss your doctor's appointments, because that monthly checkup or the monthly visit is really important. It will help to identify problems that are going wrong. It will also help us to get the treatment going on time. There won't be any delay. For even 1 month that you miss your appointment, your treatment is delayed by 1 month. So even recently, unfortunately, we had a patient whose treatment was almost done but missed 2 appointments, and when we saw him the next time, the whole thing had gone haywire. So it's not exactly the patient's mistake. Of course, it's the patient's mistake, but such things should not happen, because we are trying to religiously keep it going in very systematic order, and things like this can upset the whole treatment, and then we have to go back almost to square one. Another mistake what happens is, after the treatment, many patients think that this is over and it's done. But no, this is the last phase of the treatment called a retention phase, where we give certain retainers. Now, retainers can be transparent like this, it can be fixed on the back of the teeth, or it can be a single bar running across your teeth in the front. The dentist will advise you how long it has to be worn, whether it is for 6 months, whether it is for 1 year, whether it is for 2 years, or whether it is permanently. Please follow that instruction. It's very important, because how much of a treatment is successful, how much ever you have achieved, if you don't have the retainers or the right amount of time, the treatment can relapse. So that doesn't make any sense, especially after spending so much of time and so much of money and so much of effort in getting it right. So I hope you have understood a little gist about orthodontics or braces. I'll just review again. You have regular metal or conventional orthodontics, you have ceramic braces, you have self-ligating braces, and you have aligners. In terms of cost also, the most economical is the regular metal braces, followed by ceramic and self-ligating and aligners. So if you recognize that you have asymmetric teeth are not in alignment, or you have certain discomfort while chewing, your teeth don't feel like they are biting in the right way, please visit your locality or your family dentist, get his or her opinion, and start orthodontic treatment at the right time. So till we meet again, ciao.